Hello, everyone, and welcome to the Genetic Genius Vibe. I'm Dr. Lulu, and I'll be your host today. And I'm going to be talking all about leaky gut, one of my favorite topics to talk about because it's so related to so many aspects of your body and other symptoms and other aspects that might be affected. So, I'm going to be talking about what leaky gut is all about, as well as how to heal the gut both physically and emotionally, because the emotional component of leaky gut is a huge piece of the whole equation. So, first, let's talk about leaky gut in general. What is it? And basically, if you think about your gut, it is a big tube, right? Running a big, it basically starts in the mouth all the way through the anus, but we're really talking about the intestines. So, your intestines have a mucosal lining, and within that mucosal lining are cells that come together and they are formed a gap junction. And you could think of that two squares like coming together and locking in. And that creates a tight junction or gap junction. And in a normal gut or a healthy gut, right, those gaps are really nice and tight and formed close together. But what happens is, due to different things I'm going to talk about, is those specific junctions become open and loose, and then proteins start to leak through that mucosal lining out into the bloodstream. And then this causes the immune system to have a reaction because it's seeing foreign particles in the bloodstream that it wasn't aware of before. So it says, "What are you doing here? I need to form an attack against you." And so it creates immunoglobulins and cytokines, which cause a inflammatory reaction against those proteins in the system. And because there's an inflammatory reaction happening, our bloodstream is out throughout the entire body. So we're going to see then symptoms of leaky gut affecting major systems, not just the gut, which is why, one, sometimes it can be hard to determine if it is leaky gut because you might be having, let's say, for instance, thyroid problems and Hashimoto's. And you're like, how is it connected to my gut? So when we think about the gut, everything starts in the gut. The gut is our physical aspect of our body, which is always communicating to the brain. Everything we think about begins and quote unquote ends also in the gut. It's just leaving the system. So, what are some of the ways that then the quote unquote causes? What is causing that leaky gut? A big, huge piece of leaky gut is genetics. So, we can see when we look at a genetic profile, we can see in the genes the epigenetic profile, nutrigenomic profile, we can see how specific components are making a person or can make a person more prone to leaky gut. So that's a big person. I always want to look at the genetics. I always look at genetics anyway, but especially when I'm suspecting leaky gut, I want to do a genetic profile and to see if there's specific genes that are being turned on that can then relate to leaky gut. Poor diet is a huge one. And so when we're most common Americans, the standard American diet, we eat about the same 30 foods over and over again. And a lot of those foods are inflammatory foods. When we eat a lot of inflammatory foods, it causes the gut to be inflamed. Then that causes that leaky gut reaction to happen. So that is a huge piece. The other one is chronic stress. Now, this is one from the physical component, but also the emotional component. And we will see in a chronic stress reaction that a lot of people say, "Oh, I'm so worried. I always feel everything in my gut." That's because the gut is kind of like wrenching all that stress and tensing inside the system. And not only physically, but emotionally. We're feeling that emotional trauma or that emotional reaction in the gut, causing that stress reaction, causing those gap junctions to open up and loosen into the bloodstream. Another piece is toxin overload. We're really living in an environment that is much more toxic than we're used to in a past generations. And we're not then eliminating those toxins on a daily basis, monthly basis, quarterly basis, yearly basis, right? And then we have a toxic buildup, especially as women. We do have the aspect of eliminating through our cycle. But as our hormones are disrupted and as the liver is then overloaded, we have a backup in the system, which leads us more commonly, I feel, to not only leaky gut, which can lead to other things like thyroid and autoimmune disease, but we're more prone to having that buildup. And the other huge aspect of leaky gut is dysbiosis. So, dysbiosis basically is a fancy word for bacterial overgrowth or bad bacterial overgrowth. And so, when that happens, that bad bacteria then affects the gut lining, all of the the ways that the gut is absorbing all of the aspect of the gut in relationship to the immune system, because you have an immune system in the gut called the GALT. And so all aspects of the gut are highly affected by bacteria. So that's one of the things that we look at when we're healing leaky gut. So let's look at some of the things that leaky gut leads to. We talked about causes. Oh, I want to talk about some lab tests first before I go forward. So how are we determining leaky gut? So we want to make sure we're doing, of course, we can look at the symptoms, but from the functional medicine and naturopathic perspective, we want to dive deeper, right? What is the root cause of the leaky gut? Not just treating symptoms, right? We always want to treat the root cause. So I always want to do, there's a couple tests. One, I want to do a GI map. I really want to see what's happening with the stool, what's happening in the bacteria. Is there a bacterial overgrowth? And that is a really important component. So a GI test. And then in that testing is to do zonulin. Zonulin will increase if those gap junctions are open and loose and things are flowing into the bloodstream. So if that number is really high, it's a good indicator that there is leaky gut happening. Also, remember I talked about poor diet, and food sensitivities are a huge piece. So we want to do a food intolerance IgG test to see if you're sensitive to foods. Are you having reactions? And in our healing part, we'll remove some of those inflammatory foods and some of those specific food sensitivities. So a huge component for the testing piece. The other piece that I'd like to see is in relationship to malabsorption. So we can think about if your body is leaking proteins, it's also leaking all the good stuff, right? And so we'll have malabsorption, which means that the gut is not absorbing what it really needs. So an organic acid test, vitamin and mineral deficiency test will show us if you're deficient in specific vitamins, vitamin B, vitamin D. We want to look and see how you're absorbing. And that is a huge component. Let's say you were thinking that you have a specific disease happening in the system, and you're taking a huge list of supplements. You're like, nothing's happening. One, you probably will misdiagnosed, right? But maybe you're taking all these supplements and nothing's happening. It's because you're not absorbing them. Everything's leaking out of the system. So we really have to come in and repair that gut lining to allow your body to absorb. So those are some specific tests we really want to look at in relationship to leaky gut and determining if there's leaky gut. So all of those things, then what are they then showing up in the systems that are out of balance, right? That's what we're always looking at. What systems are out of balance, that when the root cause is happening, we see all these other systems affected, right? Because our body is a holistic model. Everything works in a symphony, right? When one thing is out of balance, let's say, for instance, the violin is off key, it's going to cause the other instruments to become out of balance. So I talked about food sensitivities. That's a huge component we want to look at. Are you having food sensitivities? Now, remember I talked about too, that chronic stress piece. So if you're having IBS symptoms, a lot of chronic diarrhea, chronic constipation, or a mixed IBS, that's an indicator that you could have leaky gut. Autoimmune disease. Whenever I have a patient where I'm suspecting autoimmune disease, I always want to think about the gut, because those proteins are leaking into the system and causing chronic inflammation, systemic inflammation. And the body then creates or has a reaction that can lead to an autoimmune disease like Hashimoto's. The thyroid is highly connected to the gut, right? A lot of its major components, like controlling metabolism, are related to the gut. And we'll see, for instance, Hashimoto's and celiac disease highly connected. So whenever I'm suspecting leaky gut, or a person is coming in and seeing me and they're having Hashimoto's, I'm always going to do that testing with the gut. How's the gut? Let's heal the gut. How can we help heal the thyroid in relationship to the gut, etc.? The other piece is that malabsorption. Are you having a lot of malabsorption issues? Everything that you're eating just doesn't seem to be sticking, right? You're like, have no energy. Those supplements you're just peeing out. Nothing you're doing is working, right? And that can even be signs and symptoms of bloating, gastrointestinal dysfunction, diarrhea, constipation, bloating, cramping, burping, all of those things that can come along with malabsorption because your body's not breaking those things down. Seeing food in the stool. Hey, when was the last time you looked at your poop in the toilet, right? You want to check it out and say, like, what's going on? What is the size? How does it look? Is it clumpy? Is it floating? Is there food? Is there fat on the toilet lining of the water, right? What's going on? Is there blood? All kinds of things. You are the person that is looking at, you should be looking at what's coming out so you can know how your poop is, so you can identify it and know if there's a change, but also communicate it with a naturopathic doctor like myself. So I can ask the questions. You can say, oh yeah, this is what's going on. So a poop journal or food journal is a great way and a really easy way that comes from that place of healing the gut physically. So that's a huge component because you want to know what's going on. So those are something. Oh, the other two pieces I want to mention are skin. So the skin is our biggest organ. And when the gut is out of balance, immediately we see that on the skin. So eczema, psoriasis, skin breaks out, rosacea, we'll always see those components happening on the skin. And stress is a huge component of skin issues. And I talked about how chronic stress can affect the gut. Let's say, for instance, you're having breakouts on the skin and every time you're in a more stressful situation, those breakouts then become more red, more inflamed, more itchy, a huge sign of gut imbalance. And the other aspect, which a lot of people don't think about, is the mood connection. So the brain and the gut are communicators, especially with serotonin. Serotonin is made in the gut. 95% of serotonin is made in the gut. And when we have a gut imbalance, we're going to have those pro-inflammatory cytokines that then studies have shown lead to depression. So whenever I'm seeing a patient who's having some of those mental health imbalances, anxiety, depression, etc., I'm always going to look at the gut, and you want to see, are those inflammatory cytokines, those pro-inflammatory cytokines leaking out and causing imbalances with that gut and brain connection. So let's talk about the physical component about healing the gut. And then I'm going to talk about the emotional component as well. So when we're talking about healing the gut, it's a 4-step process. 4 R's is how I like to call it. So we're going to remove, replace, repair, and rebalance. So it's a super easy process. Now, I say that, but also sometimes that can take a patient longer. Let's say, for instance, you've been having leaky gut for many years, affecting the whole system, and it's gotten worse and way out of balance. It can be healed overnight, right? If you make the changes and with the physical and the emotional system. But what I've seen most commonly in patients that have had a long history of emotional and physical imbalance in the gut, that core center, that hara, that is when it takes longer to heal. But change can happen overnight if you're willing and accepting of that piece of change. Are you able to activate your inner healer? Are you able to understand what's going on? Are you able and willing to make the changes in all areas of your life? And sometimes those changes aren't able to be made overnight. Maybe it's okay, I can't change all my food, I can't do this, but what's that time frame? So I could see a lot of times I'll see that from a 3 to 6 to 9 to 12 month period, depending on the patient. So that's like your gauge there. So we're going to remove all foods and factors that have been damaging the gut lining. So removing first, anything that's inflammatory. That's where that piece of food intolerance testing comes into play. Then 2, we're going to replace. So we want to replace all of those foods that were causing inflammation and a reaction, a food sensitivity or intolerance reaction. We're going to replace those with healing foods and anti-inflammatory foods. And that particular diet can look different based on the individual. Everything is always individualized, right? Especially when we look at the components of a genetic test coming into that piece. So we want to look at replacing those those inflammatory foods with healing foods, bringing in an anti-inflammatory diet, which could look like paleo. It could just look like a simple diet of removing inflammatory foods based on the person. Now, if the patient is having a lot of autoimmune disease symptoms and has already been diagnosed with an autoimmune disease, I'm going to put that patient on most likely an autoimmune paleo program to really reduce all the inflammatory aspects of foods to help heal the gut. And if the patient has a lot of inflammatory skin issues, I've seen this hands down help tremendously. Then the third is repair. So we're going to repair the leaky gut with specific supplements. And this looks like glutamine. So glutamine is going to repair that gut lining and those gap junctions, bringing them closer together. Enzymes to help the body break down food, starting in the mouth, working all the way through the digestive system. We're going to use then herbs to help heal the mucosal lining. Licorice is a great one. Marshmallow root. These are mucilaginous herbs that help really soften and heal all the digestive lining. We don't want to just work on the intestinal lining, the mucosal lining of the large intestine and small intestine, but everything, the mouth, the throat, the esophagus, the stomach, all of those linings. Now, mushrooms are also a great one, especially reishi and lion's mane. These specific mushrooms will help with the inflammatory reaction of the gut. Remember, I mentioned the GALT. That is our immune system of the gut. We want to boost that immune system. We want to help support it. Not from that inflammatory perspective of having a systemic immune reaction, but we want to help have a balance of the immune system. We want to help have a proper immune response. So that's a really great and important. And then step number 4 is all about rebalance. And this is where the probiotics come in. So remember, I talked about how the gut is out of balance with dysbiosis, bacteria that is overgrown. And this doesn't necessarily have to be quote unquote bad bacteria, but sometimes we can have an overgrowth of bacteria that shouldn't be there. So looking at that lab test from the bacterial perspective can show, 1, are there specific bacteria that's out of balance? 2, there might be some other things in the system that we need to look at bad bacteria, viruses, etc., that are causing that dysbiosis. So probiotics, looking at the specific bacteria and then bringing in a probiotic that is specific for the individual based on that bacteria, not just a random probiotic. We want to feed the system what it needs. When we feel the system what it needs, it heals. And with healing, that is that rebalance. So those are the steps when we're talking about the physical component. Now, from the emotional component, we want to look at the system of the third chakra. So that emotional system is all about our power center. And what I see with patients, when the gut has lost its ability to work in balance with the system, it's always connected to an emotional component of a loss of power, right? You've given your power away. So to regain that power back, looking at our perspective, where are you not in charge of your life, in charge of your purpose? So using a mindset component, reducing stress, visualization, meditation, 2, bringing in the component of breathing. Breathing really helps to charge that gut, really brings in and strengthens that core. When we have the component, you could think of the third chakra of the gut is this yellow color, this power, right? You could think of that power as being really dim in leaky gut. It's like you have this light yellow. We want to bring out that brilliance of the emotional system and increase the power. So looking at journaling, looking at all the areas of your life, and this would be a great task for you if this is all resonating with you, right? Looking at all these things, connecting with me to make an appointment to really get to the root of it, but also start some journaling, writing down, where are you having a power leakage emotionally? Are you giving too much power to this specific situation, a relationship, something with your work, a component in your house, your business? Right? Look at in your health. Where are you having a leakage? If a pipe was leaking in your garden, a hose, you would find that leak and stop it, right? And put a patch on it. We want to have a patch. We want to have a full patch, a healing patch. So that's that emotional component. And next week, we're on the Genetic Genius Vibe. I'm going to be doing a meditation, a healing gut meditation. This is going to address not only the physical aspect, but also the emotional aspect of the gut. So I hope you learned a ton about the gut today. I went over a lot of things. If you need more help, I have a couple things that can help. 1, I have an emotional gut transformation class. That's going to be starting on October the 18th. So sign up for that. That's a great class. You'll see that link in my bio. And then also there's a wonderful freebie I have this month. This month is all about the gut. So there's a freebie for my natural solutions for leaky gut. So grab that, just go to my bio in the tap link and you'll see the freebie right there. Download that, look at that, reach out to me if you need help. Remember, I'm here to support you. I'm here to raise your vibe, to help you raise your vibe. And so remember that you are your inner healer. How are you going to activate it? You are in charge of your healing. What are you going to be letting go to really activate that gut? So thank you so much for tuning in today, and I'll see you next week.